Hi everyone, I'm Dr. Arshad from Brooke Surgery. Thank you for tuning in to today's live video, which is on are vaccines safe for my children? This is a topic quite a few of our patients were asking some questions about over the last few weeks. And there are quite a few topical matters around this recently over the last few years. So we thought it would be a useful video to go over today. So we'll talk about vaccines. So first of all, let's give you an overview of vaccines. So vaccines are the most effective way to prevent infections. Infection diseases like measles, flu, meningitis, shingles, and many more. And in today's video, we're going to explain why vaccines are important, what's inside a vaccine, how vaccines work, and why they are safe. So let's start off with the first point. Why are vaccines important? So vaccine is the most important thing we can do to protect ourselves and our children from becoming ill. Since vaccines were introduced in the UK, diseases like smallpox, polio, and tetanus, these are diseases such as that actually have killed, disabled millions of people throughout the country, are either gone or basically never seen. And this is thanks to vaccines. Other diseases like measles have been reduced up to approximately about 99% since the vaccines have been introduced. However, if people were to stop having vaccines, it is possible for these infection diseases to quickly spread again. What's inside a vaccine? So the main ingredient inside a vaccine is a small number of bacteria, virus, or toxins that have been weakened or destroyed in a lab. Now, this weakening means that there is no risk to healthy people catching a disease from the vaccine. So naturally, the next question is, how do vaccines work? So vaccines teach your immune system how to create something called antibodies to protect you from the diseases. It's much safer for your immune system, and especially your children's immune system, to learn this through vaccination than by actually catching the disease itself and having to have it treated. Once your immune system knows how to fight a disease, it can often protect you for many years to come. Having a vaccine also doesn't just benefit yourself and your family, but actually benefits the whole community. And this is something called herd immunity. You may have heard this term recently quite a lot with the COVID situation. Now, what this means is if enough people are vaccinated, it's harder for the disease to spread to those people who cannot have vaccines. So, for instance, those who are ill or those who have a weakened immune system, they would benefit from other people around them from having the vaccine because they themselves cannot have it. So what are the side effects of the vaccines? So most of the side effects of vaccines are usually mild and don't last long. The most common side effects is the area where the needle goes in can often look red and swollen and can be sore for 2 or 3 days. In babies or young children, they might feel a bit unwell and they can sometimes have a high temperature for 1 or 2 days. When a child gets vaccinated, some children may also cry or upset immediately after the injection. This is completely normal. And often they feel better after a cuddle and some comforting from the parents. It's actually very rare for someone to have a serious allergic reaction to the vaccine. But if this does happen, it usually happens within minutes. The person who vaccinates you or your child will be trained to deal with allergic reactions and will treat them immediately. With that quick treatment, you or your child will make a good recovery. So, to the main question here, why are vaccines safe? There's a lot of misinformation out there, and it's useful for us to kind of clarify this and make sure that you have confidence in vaccines. So it's important to know that all vaccines are thoroughly tested to make sure they will not harm you or your child. It often takes many years for a vaccine to make it through the trials, and tests are needed for approval. Once vaccines reach the point where everyone starts to use them, they then become monitored for any rare side effects by government agencies. In this case, there's an agency called the MHRA. This process is in fact completely transparent. Anyone can report a suspected side effect of the vaccination to the MHRA through the yellow card scheme. And we will post them a link. I'll try to post one shortly so that you can see this firsthand. So let's talk about some vaccination tips for parents. It can be quite an anxious time for a parent, especially with a newborn. So, for any parents who's watching, whose children may be due a vaccine soon, here's some tips. So first of all, on the day of your appointment, do not rush to get to your appointment. Give yourself plenty of time that can have you and your child feeling stressed or anxious, as often a child can pick up on your stress and anxiety levels. Even babies can do so. So if you're calm, the child is likely to be calm too. Don't be worried about speaking to the nurse giving the vaccine or even a doctor beforehand. They can answer any questions you may have. Remember to take your red book to the vaccine appointment, as this is where all the vaccines are locked. If you're having a baby being vaccinated, dress the baby in the appropriate clothes, as babies under 12 months can have injections in their thigh, so having something that's quite easy to remove can be very helpful. If you have a toddler or older child being vaccinated, dress them in loose or short sleeves, as often they can have the injections in their arm, upper arm. So key thing here is trying to stay calm during vaccinations. It's natural to worry, but to allow your child to feel less anxious and less restless, you can transfer some of that calmness over to them. So that's very important. Now remember, the area where the needle goes in can be sore for 2 or 3 days. This should go away on its own, and if your child develops a high fever after vaccination, make sure they're not wearing too many clothes or blankets, give them plenty to drink, and even the use of paracetamol can be useful to bring their temperature down if appropriate. So, in summary, this has been a relatively long video. I understand a lot of you may have some questions about what I've said. Feel free to write them down in the comments below, and we will usually get back to you within 24 hours. Or for the patient of the Brooke Surgery, you can also leave a comment, or as you're aware, you can use our online system to send us a message. And as always, we will get back to you that day. For those of you who are thinking about joining the Brooke Surgery, I'm pleased to say that we are accepting new patients. It's worth knowing that we don't have any queues, you don't need to call, and you will get a same-day appointment through our new online system. Head over to our Facebook page or our website and leave a message in the comments. You can sign up and switch online within minutes. So, to summarize what we have discussed today, vaccines protect you and your child from many serious and potentially deadly diseases. Vaccines protect other people in your community by helping stop diseases spreading to people who can't actually have the vaccines or who have not yet had the vaccines. Vaccines are safely tested for years before they're introduced. Vaccines are constantly monitored for any side effects. Vaccines do not cause autism. Studies have found no evidence of a link between the MMR vaccine and autism. Vaccines do not overload or weaken the immune system. It is safe to give children several vaccines at a time, and this reduces the amount of injections they need. Vaccines do not contain mercury. Speak to your doctor if you have any known allergies, such as eggs or gelatin, but vaccines do not contain any ingredients that cause harm in such small amounts. Sometimes vaccines can cause mild side effects that will not last long. Some children may feel a bit unwell or have a sore arm for 2 or 3 days. And remember, if enough people are vaccinated, vaccines can eventually reduce or even get rid of some diseases. So thanks for everyone for tuning in. And I'll see if we've got any questions coming through. So I'm just going to pull them up now. So, it's a good question here. So it says, why is there a new flu vaccine every year? So it's a good question, really. So unlike most vaccines, most contain strains of the disease that are rarely changed. The seasonal flu vaccine changes frequently, though. And that's because there are one or more of the flu strains in the vaccine that may be retained from 1 year to the next. And this is because the actual influenza virus that circulate are constantly changing, and therefore a new vaccine needs to be created. Each year, researchers choose viruses for the vaccine based on which are likely to be circulating over the course of the flu season. And therefore, this provides protection against some of the most prevalent strains. So when you get a seasonal flu vaccine, you're usually not getting another dose of the same flu vaccine you had the year before. Usually you get protection against a whole new batch of flu viruses. Another question, why can I not get some vaccines if I have an egg allergy? So this is a good question as well. So some vaccines, including the majority of vaccines against influenza, are cultured in chicken eggs. So during the process of creating the vaccine, the majority of the egg protein is removed, but there is some concern that these vaccines may generate an allergic reaction in individuals that have a known egg allergy. I hope that answers your question. So, this question here, are you sure that vaccines do not cause autism? So this is a question that we have had quite often. So to clarify, the vaccine do not cause autism. There was a paper made by a British physician back in 1998 who claimed there was a link between an MMR vaccine that was linked to autism. This has been explored very thoroughly, and study after study showed that there was no original link at all. And in fact, the original study that was put out has actually been withdrawn and the doctor himself has had some consequences as of it. However, it's a likely misconception that still occurs because of the timing between the childhood vaccination and when autism first actually appears as a symptom. And sometimes people often make a correlation between the two, but there's no evidence to suggest that. So yeah, you can go through this video again if you've missed any parts of it. If you've liked or enjoyed this video, please like, share it on your wall. And we will be having more videos coming up. One of the next lot of videos that we will be doing is some live interviews. So I've got another question here. One of the questions that's come through, I will need to read through because a bit of information here that I need to read upon, and I will answer that. So keep the questions coming, even when the video has finished, and I will be replying to them within 24 hours. Okay. So thank you once again for tuning in. I hope you found this video useful, and please do like and share. Thank you very much.